Hello and thank you. My name is Steven Goldstein, and I'm here to introduce you to the exciting modality that I have developed over 30 years called fascial therapy. Now, fascial therapy is a hybrid of many different modalities, but at its core, it's working with more indirect methods than direct. Indirect is basically drawn a lot from the field of osteopathy, and what it really implies is that we can use more gentle, non-intrusive touch to affect really great and profound change with the soft tissue of the body. It is designed around respect at all times of the autonomic nervous system, and with that in mind, one of the key principles that I try to put across is that all soft tissue release is predicated on the discharge of the autonomic nervous system. And so what we do is we set up a situation for the body to be in a state of what we call parasympathetic rest and repose. And often what we're trying to do is to find those mechanisms through the use of touch, intelligent, conscious touch, to go ahead and bring and moderate the body out of what we call a higher sympathetic tone into a lower. Once that's achieved, then through the modality, we go about different assessment patterns. And again, the assessment patterns are either through palpatory literacy on the surface of the body, but also through range of motion and motion patterns. We're always looking for the first level of restrictions. Now, those restrictions can easily be assessed through what we call ease and bind. So at the core of all these techniques, ease being the ability to find a barrier in a plane of motion that is the least resistance, and bind being that barrier that has the most resistance. And so as we work through this coursework, we unpack those techniques in a more global manner. And that global manner implies not only a global response through the autonomic nervous system, but it also implies teaching you how to assess globally, how to work with both a macro and a micro, with a global and a local orientation. And through this orientation, you begin to discover that how we teach in fascial therapy with the variables of touch applied to varying tissue levels, to varying soft tissue structures, such as not only the main form, which is myofascia, which is always we're thinking about, and we have principles that we consider when we're applying touch, but that it encases all the other soft tissue, that including the muscular tissue, which is the primary encasement, but also the joint structures, the tendinous structures for the muscle, the ligament structures, and the neural structures. Further, if we were to do advanced trainings, though, we would consider visceral and vascular structures. But within the content of what I'm doing when I have to teach beginners is that we start really with the surface wrapping at a superficial level. Now, that superficial level can have a profound effect on the deeper fascial level and on the deeper nervous system. So I want to encourage you and invite you to this amazing clinical exploration that can help you achieve immediate results in your practice. It'll help you realize that, in fact, when you know how to harness your touch, that less becomes more. That the touch is not only procedure and technique, but communication and expression and intervention. So we have respect for a bigger picture, almost the soma of the body, as much as how important the anatomical anatomy is. And so really, with fascial therapy, we sort of have a foot in both worlds. We have both indirect methods that some might even call energetic, and we have very direct methods that are very sound and evidence-based. So what I try to teach you in fascial therapy is what we call best practice. And that best practice is how to blend these methods. The nervous system really wants novelty. It doesn't want one method. And this mix, this ability to mix and match as the presentation dictates, as the nervous system dictates, as the client dictates, because at the end of the day, we are dealing with a sophisticated, conscious, holographic nervous system that may be in great distress and pain. And we must understand how to utilize our touch, how to create a literacy through touch that can first modulate that pain and then start to bring about soft tissue results. So I invite you on this exciting journey. I invite you to explore this method with me, fascial therapy, and I thank you for your time.